Joining me online from Cape Town to discuss how e-cigarettes have gained popularity among our teens is University of Cape Town pulmonologist Professor Richard van Zyl-Smith. Richard, thanks very much for making the time to join us today. You've done a small study in South Africa among teens that have shown that many teenagers take up vaping because of stress. Tell us more about that.
So our pilot study, we used high-income schools just as a convenience sample and asked the question, obviously, how many are vaping and why do you continue to vape? And amongst those answers of why do you continue to vape, the anxiety, stress, coping came out very strongly. Now, it's obviously not the only reason. For others, there's clear nicotine addiction.
Supporters of vape often quote a statistic that e-cigarettes are around 95% less harmful than tobacco. And this comes from the UK government's review of evidence of e-cigarettes. Do you know how they came to this conclusion?
The 95% safer paper is a paper that was put together, published in a reasonably obscure journal, and put together by a group of individuals that don't have the cleanest record, as it were, from a scientific point of view in relation to their affiliations with tobacco industries and harm reduction industries. So there are a couple of red flags in terms of how it was done and who was involved. There's only one paper, and it's only that paper. And so many of us in the space say, well, 95% we think is not the correct number. Just given the number of chemicals and the dangers of tobacco, it is likely to be safer. But 95% is a very, very, very tenuous estimation. And that also only applies to people who are smoking and have a 50% chance of dying from a smoking-related illness.
Why would a government take that information and base the entire policy on that, as the UK government has done?
The UK really are an outlier in the space. Most other countries are very anti-vaping. Most other countries consider smoking cessation to be fresh air, whereas the UK consider it to be vaping. But you may have seen recently that the UK has announced they're going to try and ban disposable vaping devices because they're seeing this alarming rise in vaping amongst adolescents. So there clearly is something afoot in the UK where saying it's safe has caused problems.
In your experience and also research-based, is there any data that's available to show us that smokers who want to quit smoking do turn to vapes?
There is a Cochrane review that looks at all the evidence and makes recommendations, and it very disappointingly is not a very good option. Now, it doesn't mean it doesn't work for the individual. But if you said to me, what's the best way to stop smoking? Vaping wouldn't be on the top of my list.
What would be topping the list to try and stop smoking? What works the best?
So behavioral modification is the buzzword. To understand why you smoke, what's triggering, and how do you change your behavior? Are you stressed? Are you anxious? Do you smoke? Are you bored? Are you angry? Whatever it is that triggers you. And that behavioral modification to try and break the habit, in addition to pharmacotherapy, so either a patch or one of the oral medications to help with the nicotine withdrawal, those two in combination is the best option.
So say you do try vaping to quit smoking. Is it a safe option to try? Are there any harms involved?
So it would be considered a safe option to use, but we would always advocate it as a stepping stone, not only from a safety point of view, but of a risk point of view, because you're still exposing yourself to chemicals, as well as remaining addicted to nicotine, as well as spending the money. So the best option is fresh air, which at this point is still free.
Now, if we just look at the nicotine that's in both tobacco and in vaping products, are there harmful effects of nicotine? Is that bad for you, or is there argument to be made it's okay to have a little bit of nicotine?
So nicotine in and of itself is not what the term we use, biologically inert. It is not a harmless substance. It's a poison that you can use to kill insects. Taken in large doses, causes a significant problem and can kill you if you drink a bottle of vape juice, for example. And the way nicotine works in the body, not only from an addiction point of view, it has impacts on the immune system. It has impacts on the endothelial system. That's your blood pressure and lining of your arteries. And it can also impact on growth of blood vessels. There's a little bit of an argument and discussion around whether it is a cancer-causing drug itself. Most people would agree that it doesn't cause cancer, but it may promote the growth of cancers because it promotes the growth of blood vessels.
Nicotine is a Schedule 3 substance, so it gets regulated. When we look at vapes, do the ingredients in vapes, including the nicotine, get regulated when it's included in a vape? How does that work?
So the problem with vaping is there's no regulation. It doesn't fit into any standard regulation. It's not a food substance. It's not a health product. It's nothing. So the government has not had the ability to regulate it. And the regulation currently before Parliament has been 7 years in the making, which will finally regulate vaping. And the proposed bill will regulate vaping exactly like it does tobacco.
Finally, what do you think of organizations like Vaping Saved My Life? They argue that you should make vapes more available, cheaper, so that you could save more people from smoking, essentially, or get them to quit smoking. What do you think of that philosophy?
I have many issues with Vaping Saved My Life because you don't know that it has saved your life. That is only in the future.
Thanks very much to Professor Richard van Zyl Smith for sharing his insights on vaping with us.